He gently raised the woman's legs, then he injected a muscle relaxant into her. Once the woman's muscles were completely relaxed, he let her slowly inhale the anesthesia. It took less than a second, and the woman lost consciousness. The doctor then supported her neck, used a tool to gently open her mouth, and inserted an oxygen tube. Seeing that the woman had fallen into a deep sleep, the doctor placed tape close to her eyes. This was supposed to be a routine procedure, but the doctor, while performing the surgery, explained things to his apprentice. Suddenly, the anesthesiologist stood up quickly. She noticed the patient's blood pressure dropping rapidly. The room immediately became tense. Everyone watched the instruments closely. Thankfully, after a brief panic, the patient's condition stabilized, although it was just a scare. The surgery was still completed smoothly, but right after that, the woman suddenly lost consciousness. No matter how the doctor called out, she did not wake up. The doctor quickly checked her pupils, but there was no response.
Oh, Jesus Christ, her pupils are fixed and dilated.
What? The pupils? They're fixed, dilated.
The lead surgeon rushed forward to check and immediately declared the woman brain dead. But the woman had no medical history before the surgery, and the procedure had gone smoothly. So how could she suddenly be brain dead and slip into a coma for no reason? After consultations with several specialists, they speculated that the woman may have had an allergic reaction to the anesthesia, because in millions of cases, a few people experience such reactions. The hospital concluded that it was a rare occurrence, but Dr. Daisy insisted on investigating further, because the patient was her close friend, and Daisy had recommended the surgery to her. Daisy began reviewing the medical records, but she found nothing unusual except for a questionable lab report. The hospital had tested her friend's tissues, but such tests were unnecessary for this type of procedure. This puzzled her husband too. Even more surprising, the lab report had no identification number, and the doctor's name was missing. This seemed like an attempt to cover something up, but her husband naively believed that it was just a mistake by the hospital. After all, these things weren't unheard of. He asked Daisy not to jump to conclusions, and the hospital had already conducted an investigation. But Daisy felt it wasn't normal. She decided to go to the lab for answers. When she found the on-call doctor, the doctor explained that the report was printed automatically because the hospital had a policy where the computer randomly selects patients for tests. This explanation didn't seem very convincing. Daisy remained skeptical. Next, she went to the archives to check the records, but there was no code listed in the system. Determined to uncover the truth, Daisy requested all the cases of comatose patients from the past year. When she saw the list, she was shocked to find so many patients had fallen into comas. Afterward, Daisy worked tirelessly day and night. Her actions were discovered by her husband, and they had a big argument because accessing the records without permission clearly violated hospital rules, which could